Healthcare can be fragmented at times. If you break your arm, you head to the ED. For general care, you see your primary care doctor. If you need surgery, you find a surgeon and a hospital. This disconnected care can be inefficient and costly. At Atrium Health, we believe in connecting care to provide a seamless patient experience. So we've created a model that fosters a personalized relationship between patients and providers. We're calling it Atrium Healthcare Management. The name is straightforward, but the impact is revolutionary. How does the system work for our patients? When patients come to Atrium Health, they are immediately connected with a primary care physician who coordinates with a team that can be made up of several different types of providers. For many patients, a care management teammate acts as the patient's main point of contact for the system and coordinates support from scheduling appointments to facilitating referrals. Our patients receive care across the continuum of Atrium Health, from hospitals to rehab facilities, and even through community partners. Because Atrium Health is connected by a state-of-the-art electronic medical record system, caregivers at all these locations have the background information they need to properly treat our patients. And by using analytics, Atrium Health can predict a patient's future problems and intervene before they start. Here, a patient's treatment isn't confined within the walls of the hospital or doctor's office. Our care breaks free of buildings and goes wherever our patients are. Apps and websites like My Atrium Health help patients keep track of their medical history, test results, and appointments from a laptop or smartphone. And virtual visits allow patients to see a doctor from the convenience of home. So how does this work exactly? Let's meet Jane to show you. Jane visits her local emergency department for help with her sore throat. Upon leaving the emergency department, Jane is given a follow-up appointment with her primary care office. During her appointment, the nurse practitioner reviews Jane's diabetes diagnosis with her and decides to connect Jane with her care management team. 2 days later, a nurse care manager calls and introduces Jane to her care team. First, they check to make sure Jane is taking her sore throat medication. And since Jane hasn't had a physical in so long, she is scheduled for a visit with her primary care doctor. Together, Jane and the nurse care manager create a wellness plan and set goals for Jane to improve her overall health and to learn how to control her rising blood sugars. The nurse care manager then connects Jane to the team's pharmacist, who meets with Jane at her primary care office. The pharmacist and Jane review her medications and decide together that Jane would benefit from a newer medication that will improve her diabetes and reduce her risk of having a heart event. Jane's primary care physician agrees. Jane begins taking the medication, loses weight, while gaining better control over her blood sugars. The team works with Jane to enroll in My Atrium Health, and before you know it, she's using the tool to email her doctor, check her lab results, and find exercise and recipe videos. Jane speaks with her care management team often. The care management team and Jane work together to review Jane's progress in meeting her goals. A year later, Jane is actively involved in improving her and her family's health. The great part is that Jane's care management plan may be totally different from Ted's or Steve's or Annette's. Whether a patient is already ill, at risk of getting sick, or generally in good health, each person gets a plan tailored specifically to his or her needs. Atrium's healthcare management model helps them become healthier, keeps them out of the hospital, and decreases the overall cost associated with healthcare, and that makes everyone happy.